So really the aim of this is just to make sure that every decision that's made at the point of care or about a patient in their sort of treatment pathway is informed by the best information that's available.
By joining things up and making it easily accessible, it basically prevents the patient repeating their story again and again.
I can now see their GP data, which can give me everything from their allergies to what medication they're on. Sometimes our patients are maybe a little bit muddled with what they're taking, and sometimes when you walk into a home, there's lots of different medications and you're not quite sure what's new, what's old, what they're supposed to be taking. I'm able to get that information really quickly. One click of a button, I've got all of that data in one place.
Then I can click through and look up the X-ray report that will have been done on that X-ray, and that will save the patient time, maybe avoid me having to send the patient back to A&E.
All of it takes time, so this is safe and it gives me the reassurance that I have the information I need, but saves me buckets of time.
If you're having a heart attack, the last thing on your mind is the fact that you're a diabetic. And so actually patients can forget these details. So having a credible clinical source that we can reference at the patient's side really helps clinicians make critical clinical decisions.
COVID vaccines have been a really good example of the importance of having access to the data, and particularly being able to look across different demographics and different age groups and different ethnic minorities, for example.
For the flu and COVID vaccination programmes, we're using the anonymised data to help drive where we do more, take more action to improve uptake. That could be looking at how we're delivering the service, where we're offering vaccination centres. Do we need to put more effort into a particular area in a borough?
When patients were transferred there, we were able to see their data from elsewhere across London, so the clinicians looking after those people knew what was happening to them, knew their blood test and X-ray results, and that really aided the way the Nightingale could work more effectively.
There has been, a very clear impact on cancer services during the last year with COVID. The depersonalised data, which in fact we were able to use last year across a number of NHS trusts, including a number in London, had a very significant impact in highlighting the problem on excess deaths. And that then is a driver both at policy level, but also for the NHS itself to start to think about solutions it can adopt.
So we were able to chart GP suspected diagnoses. And out of that, we produced from Queen Mary one of the earliest papers that demonstrated the ethnic differences in how people were being affected by COVID.
We're going to use patient data to empower GPs to improve immunisation levels in their population, and that will ensure every child is vaccinated and every child has an equal chance of that vaccination.
We've done some clear modelling in the NHS that will show us that we will prevent up to 2,000 heart attacks and strokes and cases of dementia across London every year. So that is huge, and it's all underpinned by data.
This isn't just to get the data, it's to really improve people's health.
You don't have to be involved, that's fine, you can opt out. But if you are involved, you're going to help contribute, which is going to save lives, maybe your own, maybe your family. The more knowledge we have, the better.
This is something that is for the future, so don't just think for now. It's actually groundbreaking for a system that we'll have in the future.